Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What is suction assisted lipectomy? Suction assisted lipectomy is a surgery done for gynecomastia. Here, in suction assisted lipectomy, it removes only the adipose tissue. Removal of adipose tissue is the important method. It is mainly performed as an adjunct surgical procedure. It is performed as an adjunct surgical procedure rather than the complete surgical procedure. Then here it is used in limited cases, not for all cases, limited cases where they are which are severe cases, or in fibrous breasts we can use this suction assisted lipectomy can be done. Then with the help of the suction assisted lipectomy, this reduces the overall size of the breast is reduced. It reduces the overall breast size and thus it results in improved appearance. Cosmetically it gives better appearance. But the main thing is it does not remove the glandular components of the breast, that is ductal components of the breast does not remove. Thus it does not correct gynecomastia. So it is not done in gynecomastia for the actual process. It is done only as an adjunct cases. But it does not correct gynecomastia. But the thing is, most cases of gynecomastia will respond to simple liposuction. This simple liposuction, most of the cases will respond with minimal glandular resection. You can do a minimal glandular resection later through a periareolar incision. So what we actually do in gynecomastia is will um, first and foremost we will do suction lipectomy is done. When suction lipectomy or simple liposuction is done and you remove the adipose tissue, and after removing the adipose tissue we make a periareolar incision. That is, incision is made around the areola of the breast, and through this incision we will even remove the ductular or glandular components are removed through the periareolar incision. This is suction assisted lipectomy.
thank you and thank you for watching.